Welcome to this short talk, Build Back Better, Implementing Collective Impact During COVID-19 Response and Reconstruction. I am Jennifer with the Collective Impact Forum, and I am the staff liaison for today's session. I will just be working behind the scenes. I think many of you know the drill by this point, and I'll be monitoring, the chat box and can help with any technical questions. And then when we turn to Q&A, we'll be monitoring that as well. We want to just also start with a Indigenous land acknowledgement. So this session is being recorded and presented on the traditional land of the Ohlone and Massachusetts people, past and present. We honor with gratitude the land itself and the people of these Indigenous communities. Before I turn it over to Lauren, a couple other announcements. I think most of you realize when you enter, you are muted and your video, I believe, often is hidden. You're welcome to be on or off video as is your preference, but we do ask you to please stay on mute. During the Q&A, you can use the chat box or you can use the hand raise function and I can take you off mute to ask questions. As I said, the session is also being recorded. So without further ado, I'm going to hand it over to Lauren. And so Lauren, you can take over the screen share.
Okay, will do. Just give me a minute and I will load this going. All right. Well, thank you so much. And I was loving seeing everyone chat their names and where they are or where they're from in the chat box. It was just wonderful to see so many different places across the country and even across the globe. There's from Vancouver, I think I saw, and Bangalore in India and Colombia. So, wow, I'm really impressed that you all are braving all those time zones to join with us. So thank you for that. And it's my pleasure to be here with you. I have, wanted to sort of talk about this topic because it's been bubbling up for me over the last, well, I guess 8 weeks now that we've been here in Massachusetts, sort of in the confinement to our homes. So let me just sort of, jump right in and hopefully we'll have some time to have a good conversation at the end. One of the things that I've been sort of wondering about, and I imagine you all have been too, is really about why this feels so different. Like, why does this feel different compared to other similar events? We had a really big economic, recession. Back in 2009, we had a pandemic with H1N1, also in 2009, but why is this different? And I think it's important to sort of remind ourselves a little bit about that. One is in those other situations, there was no requirements for social distancing, and the degree to which this has really disrupted almost every facet of our lives is just so all-encompassing. From school and daycare to work, to family connections, to religious and spiritual observances, shopping, recreation, travel. I mean, it's just really across, almost nothing has been left untouched. And that really does feel dramatically different. The other thing that is important is that the level of disruption and upheaval is not being, it's certainly not equally hitting all regions across the country or the globe, but it is hitting more widely than other kinds of sort of natural disasters, which might only hit a particular region. And I think something that we're observing is that for the first time, there are many people who are experiencing or have maybe had limited exposure to the kinds of inconvenience and uncertainty that many of the folks in our community that we work with experience routinely. But now this idea of having to organize when you go someplace, maybe not having access to transportation, having to wait in lines to get in stores, not being able to do all the things that you might have taken for granted. For many folks, that's new, that level of sort of inconvenience, and that's new too. The other piece is the uncertainty of the timeline, of course, and the extent of the impact, not sort of knowing. So all of these things sort of have created a situation where it feels different. And I go into that because in a way that is both the problem and the challenge, but it's also the opportunity because it has created such a situation of feeling so different. We have the opportunity to sort of use that in a way to our advantage. The pandemic and all of the associated crises are undoubtedly revealing and exacerbating structural flaws and failures that already existed, not just in the US, but across the globe. And we're observing this across all sorts of systems, and the infrastructures that we counted on were just clearly not prepared for this. For example, our food and manufacturing supply chains have been disrupted. We weren't able to, have the kind of protective gear that we needed. In the US, we're now talking about there might be disruptions in food supply, like meat supply, because I'm sure as you all have been maybe following shutting down of several of the meat packing plants, et cetera. Our social support infrastructure wasn't robust, and certainly our healthcare delivery and payment systems have been overwhelmed. So the structural pieces that we might have been able to ignore have now risen to the top in ways that don't allow people to ignore them any longer. And not surprisingly, and I know that I'm not telling you all anything that you don't know, given the kinds of work you all are undoubtedly doing, the disproportionate impact on underserved communities and historically marginalized and excluded populations is just overwhelming. I mean, I picked some of these articles just to kind of give you a backdrop, but there were hundreds and I don't know, probably thousands of articles one could have chosen from to illustrate this point. And where, for those of us who've been in this work, and Jen may have, I can't remember if you mentioned, I'm a pediatrician by background and worked in a city county hospital setting for 15 years, and then I was a public health official. What we call the social and structural determinants of health have been long understood to have a huge impact on health, but now people are having a realization of that maybe didn't have it before. So, the fact that this is hitting hard in rural areas, well, partially that's because the lack of some health infrastructure and public health infrastructure, the fact that rural hospitals have closed, so there's a whole sort of set of things there. This is particularly hitting Indigenous communities and First Nation peoples hard. Again, what are the infrastructure that those communities often don't have access to? What are the situations of burdens of chronic disease, diabetes, heart disease in communities that is a result of or a confluence of all of these other kinds of risk factors. But even the straightforward, or maybe not straightforward, but the more mundane things about the kind of work you do. So, we talk about essential workers and frontline workers who are in the grocery store, who are the folks that are doing that kind of work. We've all seen how they have increased exposure. They don't have paid sick leave, so they don't have the flexibility to stay home when they're sick. And they don't have access to the kind of protective gear necessarily that they might need. So we've seen, the fact that these individuals have gotten sick more frequently and unfortunately have often succumbed to this illness in a way that outstrips folks in other sectors. So the other sort of part around this is it's not only around where you live, where you work, where you have to shop for food, the conditions and where you live in terms of like crowded or densely crowded kind of housing, et cetera. But even sort of when you do try to go seek care, I'm sure many of us have seen the articles around folks of color who have presented with symptoms, who've been turned away from being tested, or have been told that they had something else and to come back another time. So all of those kinds of experiences certainly existed before, but now we're seeing them in a very intensified way. And that's why I feel like now is our opportunity to use that attention that people are putting there in a way that will sort of help us move forward in a different way.
Lauren, I just want to interrupt for a minute. I'm not sure if you're seeing it. There are some phantom red words appearing on the screen. We've had this issue in some other
Oh,
sessions too. I ask you, I'm going to start a screen share with your slides and we'll see if
okay,
that helps.
okay.
Um, Bear with us. You can keep talking though, because I know we don't have a ton of time, but I will catch
Oh,
up to
okay.
you.
I was so busy looking at the people that I wasn't looking at the that I wasn't looking at the phantom red words. So is that like one of those Zoom bomber things, or is that just
No,
some?
I think it's somebody's annotation, but I can't figure out how to turn it off. I see some chats coming in. So I will work on it, but we're short on time. I want you to keep
Okay,
chatting.
okay,
And
all
for
right.
those,
Well, I'll
and I
keep going.
didn't do a formal introduction of Lauren, but well, I'm just pulling this up. She is the co-CEO of FSG, a pediatrician, and former public health official, and we are in great hands. Apologies for just
Thank you.
skipping over that, Lauren.
No, that's. I thought we were just getting quick into it. So if we could go to the next slide, where is this our crucible moment, essentially? And I'm saying, I would say that yes, it is, and that we have this opportunity because of this renewed focus on the structural and social determinants of health, and the fact that their attention has been called to it among folks who may not have seen it before and certainly hadn't experienced it before, that we can use this. So a crucible moment is one where you have a severe trial in which elements interact to create something new. Or when there's a very intense experience that transforms us at a fundamental level. And so that's why I'm calling this a crucible moment. So I know at the beginning of the convening yesterday, Sherry and Jen spoke about the opportunity to build back better. And I was so thrilled to know that they were going to bring those concepts in from disaster recovery and relief. Because I was really struck by it too. This came about in 2006 after the tsunami in the Indian Ocean a couple years before. And the idea was that disasters, and they were thinking about natural disasters, would provide interruption that allows us to see previously unchallenged and inadequate policies and to go about addressing the practices and the mindsets that undergird them. So that's why I feel like this is a time for us to be thinking about that. But the question really is, when we say better, okay, building back better after this pandemic, what will be better? What do we mean? Like, how are we defining that? So I would offer that there's sort of three elements that, I would want to be part of the better in this case. The first is, vibrant, healthy, and resilient. So by vibrant, I mean full of energy, enthusiasm, vitality. By healthy, I think we would all be willing to sort of endorse the idea that that's when you have complete physical, mental, and social well-being holistically. It is not merely the absence of disease. And I know that there's many of you out there that would endorse that. And then by resilient, the ability to withstand and recover from difficult or stressful situations. And what we're seeing now are communities that are, have issues with vibrancy, certainly have issues with health, and absolutely have issues with resiliency. And we can choose to do something different on the way back. Now, I certainly don't want to skip over the fact that there's, a lot of folks that are in need right now, and there's a requirement for an immediate response to address urgent needs for food, shelter, et cetera. But we've got to be able to parallel process to be able to think about the now and also think about what we need to do in the medium and longer term. Because I would argue, and I suspect that many of you would agree, that we have to avoid an understandable desire to snap back to what was comfortable and familiar. We already hear people talking about, we want to go back to the way it was before. Well, you only want to go back to the way it was before if you were feeling good and comfortable. For many folks, that wasn't what they were experiencing. And so going back to the way things were before is not what we want. So I would, Jen, maybe you could go to the next one. Oh, more lines are appearing.
We're working on it.
So I would argue that the principles of collective impact can really help us achieve this idea of building back better, vibrant, healthy, and resilient after the pandemic, as we're moving out of the pandemic, whenever that happens. And the uncertainty, of course, is that we're not sure when that's going to be. And the reason I feel like it's important to include this is this issue around equity, and I know that's been woven throughout all of the sessions, and certainly it's a theme that we have at FSG and in the forum, is that this is not about it like doing it because maybe ethically or philosophically you think equity should be at the center, although those are very valid reasons. It's also because it's going to be more effective at building the kind of resiliency that all of our communities need to survive and thrive. So how can we thoughtfully apply these principles of CI to rebuilding? I want to go over just some of them. I think you all are going to be familiar with them. And Jen, if you go to the next slide, we can pick a few to talk about. These should look familiar to you. I'm not going to go over the 5 aspects of collective impact because I know this group could recite those in their sleep. But these additional principles are a few of them that I feel like are particularly useful to bring to bear in this setting. So the first is around designing and implementing recovery and rebuilding with equity at the center. And collective impact efforts who bring that sort of already that point of view will be able to address the systemic structures and practices that created those barriers to equitable outcomes, particularly along the lines of race, class, gender, where you live, et cetera. And we have to understand in this process of rebuilding how we got to where we were. So there's something about a reckoning that needs to happen. And I think collective impact, because of the kinds of relationships and bringing folks together and in the way that collective impact initiatives do, can allow a forum for that kind of reckoning and recognition of what the prior decisions were that landed us in the situation where we are now. That quote of, those who cannot remember the past are condemned to repeat it. We'd want to say that there might be some people who don't want to remember the past, but as part of our having equity at the center, we have to sort of recognize and build that into how we want to go in the future. The second piece around including community members, that's an essential part and is sort of intertwined with the equity piece. And members of the community are folks whose lives have been directly and deeply affected by the social, economic, and health impacts of this pandemic. They have to be meaningfully engaged in any recovery, rebuilding process that goes forward. I'll give you a quick example. We have in Boston a committee or a task force that's been developed to think about how Massachusetts might reopen or how the city of Boston might reopen and get restarted. There are no childcare providers on that task force. There are no teachers on that task force. There are no people who work the kind of jobs where you have to take public transportation. So clearly that task force doesn't have the kinds of insights and perspectives that would be needed to really have a holistic view. So we're saying collective impact would bring principles to that would allow that to look different. The third thing around recruiting and co-creating with cross-sector partners, can't endorse that enough. This has to be with social sector, public sector, and the private sector. And it's got to be inclusive, like we were just saying, again, these themes of inclusive. We know that being inclusive is messy. It takes more time, but I think we're going to have the time to invest because we know this is going to take a while to sort of recover from. So we need to go there. The data piece, the thing I wanted to mention there is we know that this experience has highlighted that when you don't have data about certain sort of groups or populations, they're essentially invisible. And I think are experiencing that and looking at the fact that we're not even sure what the true impact of COVID-19 has been on some of our populations of color because that information wasn't collected. So the idea of having data that you then apply in a meaningful way to respond appropriately is really, really important. I'm just going to skip over a couple of them and get to two other ones that I want to do, and then so we can have some time to talk. One is around a focus on program and system strategies. So like I said, I totally understand and respect the need to have some programmatic responses now to address the immediate needs of folks who are experiencing, significant disruption, and that is absolutely true. But we need to also be thinking medium and longer term, and I think Collective Impact can do that with its approach to systems level change. So what's underneath? What are the mindsets and the worldview that are underneath the policies and practice that have led us to be where we are? In Collective Impact, because of how it brings together folks with different perspectives across sectors, can be able to sort of tackle that, systems level approach. And the last thing I would sort of lean on or leave you with is around this piece around building a culture that fosters relationship, trust, and respect. And I feel like that's an appropriate one to end on, because when Collective Impact is done right, or multi-sector collaboration, however you would like to describe it, is done right, it can be healing. I mean, it can be truly a healing and nurturing process that takes disparate people with disparate points of view and understandings and knits them together in a way that is just really empowering and exciting and robust. And the social isolation and the interruption of all the ways that we connected together during this pandemic is going to be is creating such rifts that we're going to need quite a bit of healing. And the last thing I would say there is, I think we understand more and more that for trust to take root and grow, we need proximity. It's hard to trust someone if you don't have proximity to them or proximity and insight into their experience. And that kinds of opportunities for proximity are really limited now. So because Collective Impact is based on creating avenues for that kind of proximity, I feel like that's going to be a really important part of how we heal after this and how we're able to move forward. So I'll just pause there. I know that was a lot, and I apologize for the random squiggles that were appealing. Hopefully it wasn't too distracting, and be happy to take some questions.
Yes, and thanks. So got some excellent tips in the chat from you all, and we're able to, I think, resolve the challenge. So Lauren,
okay,
yeah,
good.
I think we got it. Disable participant annotation, and just a shout out that annotation is probably not a best practice to use during this event. So some great questions coming in, Lauren.
Okay.
I'll start with one. How do we cultivate buy-in for these principles among those who will want to uphold traditional structures? Will they be ready to do this reckoning, and how can we advocate for centering equity in the rebuilding process? And you began to touch on that a little bit with proximity, but I'd love to hear more.
Yeah, no, that's a great question. And I the metaphor that I'm imagining is like a door that's been wedged open, and we have to continue to pry it open so we can go through it and create this better situation. But as the person who's writing, it has a tendency to want to like snap closed so that it can go back. So in my mind, then, as many people and as many experiences you can get to sort of keep that door wedged open. So some of it's around data. We talked a little bit about having, adequate, comprehensive, and, about the experiences of all sorts of folks. Some folks, it's around data. For some folks, it's around the connection to experiences in ways that they didn't expect, even if it's not for them, but it's someone that they know. And unfortunately, because of how this pandemic is happening, there's many people who are being touched by this kind of loss of loved ones and friends that hadn't before. So that creates a more urgent need. And then the other piece I would say is around civic engagement and civic sort of participation. This was also this is a census year, and we were already going to be confronting some issues around ensuring that folks were able to participate and be counted in the census, and then this happened. So I can't sort of underscore enough how important it is to talk about and to encourage that kind of civic participation. The reason I say that is we see people taking their civic participation to state houses across the country in the US to protest, in sometimes armed way. So we need to sort of think about, how we can foster a different kind of civic engagement that is more inclusive and more looking for solutions.
Yeah, building on that, Lauren, any thoughts for, I guess, as opposed to advocacy, any thoughts for engaging federal agencies and or the government as a whole in such an approach?
Well, really good question. I'll try to be sensitive in how do I answer that, but I will say fairly bluntly that I feel like we haven't had the kind of leadership at federal level in terms of responding to this particular kind of combination public health, economic, and social sort of crisis. So I think that brings a lot more attention to state and local government where you have more proximity. So that can be a good news in the sense that there's more opportunity to weigh in and connect. I think the other thing I would say is that our nonprofit leaders and certainly philanthropic leaders have an opportunity to both partner together, but to bring in corporate and the business sector in ways that maybe they wouldn't have been open to before. I think the business sector is now well aware of why it's so important to have a robust kind of social support structure, because they're seeing what the aftermath of not having that is doing to their businesses. So I think there's going to be more people who can see the importance of having these kind of multi-sector collaboratives that may not have seen like, the what's in it for me. They may not have seen that before, but now they're like, okay, I understand in a different way.
Mm-hmm. Great. There are so many great questions here. It's hard to pick. So Lauren, I'm going to ask you one that is probably a question that we could do should do an entire conference on. But someone asks, we are talking a lot about the importance, but let's talk a little bit more about the how. And in particular, for example, we talked about putting equity at the center, making this more than lip service is highly complex. Yes. And it also takes time. Do you have a sense of process changes that are needed in communities to make this possible, and what might that look like? So that's probably an unfair question to ask you to answer in like 3 minutes, but we'll make that the last question. And then I know Lauren is always available. If you want to send her questions and connect through the app or offline, because there are so many great questions in here.
Yes, well, I was alluding to it when I was talking about inclusion. And I know that is a basic core tenet within the principles of collective impact. And I think that we have to sort of go beyond sort of having an advisory group maybe, or, one or two of the folks that might usually be tapped to sort of be in those roles, and to ask ourselves much more intensely, what are we doing to create that proximity so that we can have more meaningful engagement across a lot of different parameters. So that community inclusion and engagement, that's also something that I feel like our philanthropic partners can help with in terms of helping bridge that. It means that we have to have our meetings in different places. We can't expect folks who work multiple jobs, et cetera, to sort of come to where we are. We have to sort of go to where they are. We have to think about what's the critical number of having folks involved so that there's not a sense of sort of tokenizing, and also not a sense of being, of having like a critical mass, so that folks can feel connected and not sort of isolated. I think there's a whole, realm of things around what authentic community participation and community leadership looks like. But I think we have to be willing to question our own assumptions about when and how we do things. A chrysotunity. Oh, I like that term. I'm not sure who said that, but I'm going to borrow that. Someone said that this is a chrysotunity.
Chrysotunity. Hey, that's a great one, great note to end on. These short talks, the time flies by, and I think we are actually already at time. So
how did that happen, Jennifer?
I know. But thank you all so much for joining, and Lauren, thank you for your pulling this together amidst many other priorities. So thanks all for joining. We have lots of blogs actually that Lauren has written on fsg.org that get into some of these points, and on the Collective Impact Forum, I think there are definitely some pieces that you all might find interesting that go into more of the how around some of these topics. So check out the blog on the Collective Impact Forum website and fsg.org for more of Lauren's thoughts and some more on these topics. So thank you, Dr. Lauren.
Oh, sure. Bye, everyone. Enjoy the rest of your afternoon, evening. Bye. Thank you for coming.